Dr. Niezgoda has asked me to come by today and talk about the hot topics in the field of wound care, and there's a lot of exciting things going on. You know, in the practice of wound care, sometimes we're just trying things. It's almost trial and error. You try to put this dressing on, see if it works, try that modality, see if it works. Sometimes you feel like the guy coming in the bathroom. You're firing all over the place, but you're just not hitting anything. You know, how can we do things more efficiently? How can we target the treatment and make it fit the wound that we need? And I think the answer to that is diagnostics. And there are a lot of diagnostics under development right now. This is the first one, super exciting. It's a test, it's a point of care test. You do it right at the bedside, takes 10 to 15 minutes, and what does it measure? Elevated protease activity. And this is a graph that's coming from a paper soon to be published, just demonstrating that at a certain point, there's a very low likelihood that wounds will heal if they have too many MMPs or neutrophil elastase. How many wounds have elevated proteases? Well, if you look across the board at all different wound types, it's about 28%. I have an easy way to remember that. This from a couple of reps who offered to help me out. So how many wounds have elevated proteases? 28%. If you have elevated proteases, 90% chance that that's a stalled, non-healing wound. You need to modulate protease activity. There's some other new diagnostics coming out. They're also very exciting. This is the SEM scanner made by some really super smart scientists and engineers at UCLA, and it detects tissue moisture and elasticity. So we take patients when they come into the hospital, we scan over a bony prominence, it measures the amount of tissue, moisture, and elasticity, and if you have the right amount of that, then you won't get an ulcer. But if those are low values, then you're at risk for developing a pressure ulceration, and this, I think, is one of the most exciting things I've seen in recent years. What else is exciting is not only here in the U.S., where this new device will be used extensively, but also all over the world. You know, you can't have a lot of our fancy American advanced wound care modalities in Port-au-Prince in Haiti. And this is a super fantastic University of Miami Medi-Share Hospital, Department of Dermatology and Cutaneous Surgery. John McDonald and Francis Adler do a fabulous job there, but they need some advanced wound care modalities. And I think the next thing that's going to be very exciting in wound care is skin grafts that can be taken in the wound care center. You put a device on the thigh, you heat the skin up, you apply some negative pressure. The engineers have figured out a proprietary way to take blister grafts and put them right into a dressing. So you open up the box, you pull out the dressing, it has the skin on it, and you can transfer it right to the wound. We're looking forward to doing these trials both in the U.S. and in developing nations. So that's what's hot in the news right now, and I'll turn it back over